Menopause. The end of a woman's menstrual cycles is referred to as menopause. The term can refer to any of the changes you go through just before or after your period stops, making the end of your reproductive years. Menopause causes all of a woman's eggs are stored in her ovaries when she is born. Their ovaries also produce the hormones estrogen and progesterone, which regulate their menstrual cycle and egg release, ovulation. Menopause occurs when the ovaries no longer produce an egg each month and menstruation stops. Menopause is a natural part of aging that occurs after the age of 40. However, some women may experience menopause at a young age. It could be the result of surgery, such as removing their ovaries during a hysterectomy, or damage to their ovaries, such as from chemotherapy. Premature menopause occurs when a woman reaches the age of 40 for any reason. Menopause symptoms. Most women approaching menopause will begin to experience a variety of vasomotor symptoms, VMS. The most common are hot flashes, which are sudden feelings of warmth that spread across the upper body, often accompanied by blushing and sweating. These flashes can range from mild to severe in most women. You may also notice uneven or missed periods, vaginal dryness, sore breasts, needing to pee more often, trouble sleeping, emotional changes, dry skin, eyes, or mouth. Symptoms of menopause: fatigue, depression, crankiness, racing heart, headaches, joint and muscle aches and pains, weight gain, hair loss. What happens during menopause? Natural menopause isn't caused by any type of medical or surgical treatment. It's slow and has 3 stages. Perimenopause. This stage typically begins several years before menopause, when your ovaries begin to produce less estrogen. Perimenopause lasts until menopause, when your ovaries stop producing eggs. Estrogen levels fall faster in the last 1 to 2 years of this stage. Many women experience menopausal symptoms. Menopause. This is when you haven't had a period in a year. Your ovaries have stopped releasing eggs and producing the majority of estrogen. Postmenopause. These are the years following menopause. Menopausal VMS, such as hot flashes, typically subside. However, the health risks associated with estrogen deficiency increase with age. Menopause diagnosis: you may suspect that you are approaching menopause. Or your doctor will say something based on the symptoms you've described. You can monitor your periods and chart them as they become irregular. The pattern will serve as another indicator to your doctor that you are perimenopausal or approaching menopause. Your doctor may also examine your blood for levels of follicle-stimulating hormone, FSH. This usually goes up as you near menopause. Estradiol. This tells your doctor how much estrogen your ovaries are making. This level will go down in menopause. Thyroid hormones. This shows problems with your thyroid gland, which can affect your period and cause symptoms that look like menopause. Menopause treatment. Menopause is a natural process. Many symptoms will go away over time. But if they're causing problems, treatments can help you feel better. Common ones include hormone replacement therapy, HRT. This is also referred to as menopausal hormone therapy. You take medications to replace hormones that your body no longer produces. Topical hormone therapy. This is an estrogen cream, insert, or gel that you put in your vagina to help with dryness. Medications for osteoporosis. You might take medicines or vitamin D supplements to help keep your bones strong. Menopause complications. The loss of estrogen linked with menopause is tied to a number of health problems that become more common as women age. After menopause, women are more likely to have bone loss, osteoporosis, heart disease, bladder and bowels that don't work like they should, higher risk of Alzheimer's disease, more wrinkles. It can be difficult to cope with the sexual changes that accompany menopause, such as vaginal dryness and a loss of sex drive. You may also discover that you don't enjoy sex as much and have difficulty reaching orgasm. Regular sexual activity, as long as it isn't painful, may help keep your vagina healthy by increasing blood flow. You can't get pregnant because your ovaries have stopped producing eggs once you reach menopause. However, you can still contract the sexually transmitted disease. If you are not in a relationship, use safer sex practices.